In this webinar, we shall learn about pain and stress in the neonates. We tend to think that newborns are too little to really experience pain, and that if they do experience it, they soon forget it. However, research has shown that indeed babies do experience pain, and repeated painful experiences in the newborn period can lead to both short and long term problems with development, emotions and responses to stress. Just because newborn babies can't tell us they feel pain, it does not mean that they do not feel pain. They do, and we can help. From the day they are born, babies can feel and express pain. What are our learning objectives in this webinar? Over the years, we have learned to recognize and assess pain in babies. An assessment of pain in babies relies mostly on observing behaviors. In addition to noting behavioral changes that might indicate pain, there are physiological measures that can be used to assess pain in babies. We shall find out more about these behavioral and physiological parameters. Also, there are many established and proven objective tools available to assess pain in babies. PIPP scale is one such method, and we shall learn more on that. It is important to be aware of the common procedures that cause pain in babies and the severity of pain caused. Behavioral responses include facial expressions, crying, body movements and state changes. Facial expressions are generally regarded as the best single behavioral indicator of pain in both preterm and term babies. Even very small babies like a 26 weeks preterm can show an unpleasant face when they are in pain, just like older children and adults. We can identify some important facial features of pain in this picture. You see features like brow bulge, creasing and vertical furrows above and between brows. Eye squeeze is identified by noting the squeezing or bulging of the eyelids. You can see here the bulging of the fatty parts above the infant's eyes, that is well pronounced. In this slide, you can see the eyes are very tightly closed. Here you see the nasolabial furrow, a line or a wrinkle which begins adjacent to the nostril wings and runs down and outwards beyond the lip corners. Also, we see open lips in the babies. Any separation of the lips is scored as open lips. The mouth could be stretched vertically or it can be stretched horizontally. Babies in pain also show abnormal body movements like what we see in these pictures. It could be like thrashing of the limbs, the baby. It could be like a finger clenching that we identify, especially the wrist clenching. Baby can show various writhing movements, and babies can also demonstrate arching of the back. Physiological indicators like changes in the heart rate, breathing rate, blood pressure or fall in saturations are also used to determine if a baby is in pain. Autonomic changes like dilated or wide pupils, sweating, vomiting and pallor or flushing noted, they are often seen in pain. Because of changes in physiological and autonomic parameters can result from other causes including physical stress, fear or anxiety, they can be difficult to interpret. Despite these limitations, when used along with behavioral indicators, physiologic and autonomic signs can be useful as a part of an overall assessment for a baby in pain. How painful are the various common procedures that are done in the SNCU? Procedures we often do like simple physical examination, a heel prick, a venipuncture, arterial puncture, intramuscular or subcutaneous injections, insertion of a feeding tube, umbilical cannulations, adhesive tape removal, they are all painful but the severity of the pain is graded as mild. Babies experience moderate amount of pain when we talk about procedures like lumbar puncture, endotracheal intubation, endotracheal suction, intercostal drain, ventricular tapping, examination of the eyes for retinopathy of prematurity, central line either in insertion or in removal, chest physiotherapy, change of a dressing or a suprapubic puncture. When we are talking about surgical procedures are severely painful. Neonates experience pain for a longer time, what we call as a chronic pain in conditions like necrotizing enterocolitis, mechanical ventilation, meningitis, and when they have bone and joint infections. There are many tools available to measure pain in newborn objectively. Let us learn about one commonly used tool called as the PIPP scale. PIPP stands for Premature Infant Pain Profile. This scale is useful both in preterm and in term babies. You can see the various parameters used in this profile in this slide. Each parameter is given a score between 0 and 3, and finally the total score is calculated. So, higher the score, more severe is the pain. Thank you.